Okay, I believe we are live. So, what I wanted to do on this video basically was give some feedback from you on the video we did a couple of days ago between Dr. Patrick Sung Song and Tucker Carlson. And live does seem to be working. I just thought I'd do it this way for a change. It's just anyway, thought we'd try it. Now, we've been looking at cancers and cancers in younger people, and this is a big concern. And on the Tucker Carlson show, Patrick Sung Song said he'd seen pancreatic cancer in a 13-year-old. He had colleagues who'd seen cancers in children younger than that, colon cancers, things you wouldn't normally expect to see. And what seems to be happening is cancers seem to be presenting at a later stage. They're being picked up at a later stage and at a more advanced stage. So I thought we might just start off by looking at staging. Now, I'm not sure if this technology is working, but we'll give it a go. There we go. I hope you can see that. I hope you can see that. Yes, I think you can see that. Wow. Technology is great when it works. So the staging of tumours. Now, traditionally, I've always taught stage to stage a cancer as TNM. And here, T stands for tumour, N stands for the lymph nodes, and M stands for metastases. There's metastatic spread. And it's excellent. Thank you for watching. I can see your comments coming in now, which is excellent. Thank you very much for tuning in. Now, so what happens is basically an ordinary cell. So here we have an ordinary cell. And this ordinary cell will become a cancer cell. It will become an abnormal cell that looks abnormal. So to begin with, that will grow locally. And it will form a lump called a tumour. But it will just grow locally to begin with. And cancer cells do tend to grow in irregular ways like this. Cancer is called the crab. It grows, it doesn't sort of grow in nice round circles. It puts sort of tentacles out in various directions. That's why when you feel tumours, they're often what we call well fixed in the tissues because they've got bits gripping out into the tissues. So the tumour starts where it is. So if it was a small tumour, that would be T1. If it was a bigger tumour, of course, that would be T2. And you can stage it that way. Now, what happens next? If we have we have some cancer cells here. And the thing about ordinary cells is ordinary cells will stick together. They're adhesive. So tissues don't fall apart, basically. The cells are adhesive. But with cancer cells, they lose this adhesion and they can start drifting off. They drift off. And tissue is drained via lymphatics. So small lymphatic capillaries will drain into larger lymphatic vessels. And then several lymphatic vessels will eventually drain into a lymphatic node. And this is good because it filters and purifies the blood and keeps out bacterial infections. And that will then spread. That will then take the lymphatic fluid once it's been filtered through the node back into the circulation. So these tumour cells that have lost their adhesion, they tend to float out through the lymphatics and get into lymph nodes. That's what we mean by lymphatic spread. It means it started to spread. So is there nodal involvement? So again, it could be an N1, it could be an N2, depending on the level of spread. And then metastases, well, basically that's just classified as a 0 or a 1. It's either metastasized or it hasn't. So that's the sort of way we've classically staged tumours. These days, it's more commonly done by numbers. So in that case, the numbering system would be 1 to 4 typically. Stage 1 is a cancer is small and contained within the organ it started in. So it's sort of in situ. Stage 2, tumour is larger than in stage 1. Cancer hasn't started to spread into surrounding tissues. Sometimes means cancer cells are spread into the local lymph nodes. So again, how do you classify this in a stage 2? Sometimes people would say there is local invasion in stage 2. This is the UK Cancer Research Council guidelines. It isn't an absolute thing. Then stage 3 would be cancer is larger, may have started to spread into surrounding tissues. Cancer cells in the lymph nodes and spreading around. And cancer 4, of course, is its spread. Meta means change. Meta, stasis, standing in a different position, basically. Secondary spread to other parts of the body. And the point is that a lot of tumours these days are presenting at a later stage. This is the problem. They're presenting later. They seem to be growing quicker. Now, tumour grade is something slightly different. Grade is how malignant the individual cells are. So like a low-grade tumour, what we call well differentiated. In other words, the cells look a bit like the tissue where the cancer originated. Later on, the cells will become poorly differentiated, where they just look like cancer cells. We call these anaplastic cells. So that's the grade and the stage. So cancers, if there is such a thing as turbo cancers, and a lot of oncologists are now using the phraseology, then they're presenting with a higher, a more later stage and a higher, more virulent grade. That would be the way to think about turbo cancers. Now, what I want to do now is give you some of the feedback. Let me just look at some of your comments. Warm greetings from central Portugal. Thank you. It really is quite humbling the way that people watch from different parts of the world. It really is quite incredible. The other thing now is, I suspect you've seen this, where if you're not an English language first speaker, is you've got an auto-translate now on YouTube. And I did try this. I translated it into Danish, and it came up in Danish on the video. And I also translated it into Chinese. And I checked with a native Chinese speaker, and she said it was actually really quite a good translation. It was quite intelligible. So if you fancy watching in Chinese or another language, then you can do so now by clicking on the what do you call it? The bit where the words come up on the YouTube options, if that's available in your area. Now, I want to talk now about some of the comments from the video with Patrick Sung Song and Tucker Carlson. And I did particularly ask doctors and healthcare professionals to comment if they could. So I'm being distracted by your comments now. Yeah, I get, again, more comments coming in of people from people who've had cancers in their friends and families. Anyway, let's think about some of these particular feedbacks. I'm a GP of 25 years experience, writes this doctor. I remember 3 cases of pancreatic cancer in my first 20 years, but 5 in the last 5 years. So first 20 years of medical experience, 3 cases of pancreatic cancer, 5 cases in the last 5 years. And this doctor writes, that's an increase of 666%. And the doctor says that number seems strangely fitting. Another commentator writes, I'm a nurse practitioner with a doctoral degree. I've been a healthcare professional since 1990 and have never known any children to get these types of cancer prior to 2021. Now it's a different story. So nurse practitioner there, seeing more cancers in children since 2021. And the point is, there's not much research, if any, being done on this at the moment that I'm aware of. And in a sense, this is qualitative research. Now, of course, these comments could be fiction. They could be made up by bots, but I don't think most of them are. I think, and I do, of course, check to make sure it's a registered channel before I copy them out. Now I haven't put the names here of people that have made these comments. I just didn't feel it's appropriate because I haven't got their individual permission. But of course, if you did want to trail through the couple of thousand comments on the video, you could find it. I'm not a bot, says Slam RN. That is good to know. I'm very real and very scared. Well, I'm not sure. Well, forewarned is forearmed, I suppose, is what we could say. There's concerns. Another one. I work on oncology floor, and we're seeing a lot of young cancers, lots of lymphoma, but 90% of patients have had 2 to 6 boosters. This is the sort of information that health regulators and authorities need to be taking notice of, and as a result, commissioning the appropriate research so they can say, you know what, nothing to do with vaccines, forget it. Or they can say, you know what, those COVID vaccines, maybe they were a factor, and gain more information. The whole point about this qualitative research, these studies we're looking at now, this is essentially your feedback are essentially qualitative feedbacks. To me, the point of qualitative research is that it tells you where to collect. It shows what needs research so you can collect your data. Quantitative data should be done on this. Basically, universities will do research on anything you pay them for. So authorising bodies should be saying to academics, look, here's your usual stash of cash, or here's some extra cash. Go and research this specifically. Here's the databases I'm giving you access to. Here's the freedom of information you're allowed. Here's your guarantees of freedom of speech for your results. Because, of course, at the moment, we don't have freedom of speech in many areas. This is inhibiting scientific research, in my view. Let's go on, look at some more cases. My friend, 35-year-old husband, was just diagnosed with blood cancer. 5 people under 40 have died of cancer in our county this month that I've heard about. 2 doctors currently have colon cancer. Both are barely 40. We're in northeastern North Carolina. I think NC's North Carolina, isn't it? I'm a retired public health nurse. I'm very disturbed at what has suddenly started happening 4 years out now. So public health nurse, they're saying this is a retired public health nurse saying this has suddenly started happening 4 years out. What has changed? These temporal correlations need to be thoroughly investigated. My grandson's paternal grandmother just died in November, age 66, of pancreatic cancer. There's something awful happening. Now, of course, pancreatic cancer has always happened to people in their 60s, but we do seem to be seeing it younger and potentially more cases. The thing about cancers is they hide behind their commonality. They are so common, in older people at least. The reason we're seeing the cancers in younger people, and that's obvious, is these are unusual. Whereas the cancers in older people, we do see those. Cancer in old people, sadly, is common, more common. But the point is, in the pandemic, a lot of old people died, a few through COVID, some died through morphine and midazolam. Some died through do not resuscitate orders, which were taken too far, and they weren't given basic treatments. But the bottom line is a lot of old people have died, so we should be seeing less cancers. If we've got less old people, we should be seeing less cancers. And we're not, and we're also seeing more cancers in younger people. Right, another comment. I'm a British general practitioner, family doctor. Anecdotally, I think we were seeing an uptick in young cancers prior to COVID, and not just in patients with risk due to chronic inflammatory conditions. So Prior to COVID, seeing some more cancers. My practice cancer death figures for 2023-2024 showed an 80% increase on the pre-COVID baselines. So this British doctor here is saying, yeah, there were more cancers in 2019. The cases had been increasing, even in people without chronic inflammatory conditions. But then in 2023-2024, for where they've collected data, 80% more. So why should there be 80% more cancers? Is a bit strange. Why should that be? And these are all the notes I've taken directly from. Just taken all these directly from the site, from the feedback. 80% increase on the pre-COVID baseline, with cancer treatments largely unaffected by NHS time delays. In other words, these increases in cancers, this 80% increase that this doctor is seeing, 80% increase between 2019 and 2023-2024, 80% increase is not explicable by NHS COVID time disarray. Now, the NHS is in a mess, but cancer services are actually, well, they carried on functioning through most of the pandemic, let's put it that way. And the cancer services aren't where we'd like them to be, of course not, but they are reasonably functional. So this is an increase in diagnosis, not difficulty in treatment. This doctor said, we are likely to be looking for a combination of triggers. I agree. But then he or she says something quite profound, really. We're certainly looking for something. So this doctor here is agreeing that there is definitely something that is causing more cancers. This is what needs to be investigated. Another comment. I'm a doctor from the Philippines. Many of my patients' families, members have died recently, either suddenly, without apparent cause, or due to cancer. So an international phenomena, the Philippines. I tried hard to warn my patients, but very few listened. But it doesn't say what the warning was about. So many of your comments coming through that, when people put their experiences into the comments, and a lot of them are difficult experiences, it really is a noble thing to do, to share that with us. It really is. It's a good thing for people to do. Friends and relatives, and again, these are all just comments from one video. I mean, we could have picked so many more. So one friend and relative asked this. Wonder, just curious, were these people vaccinated? Is it a valid question to ask? I don't really think there is such a thing as an invalid question. As long as it's polite and well-meaning, I don't think you can ask an invalid question. I'm struggling to think of an example. So yeah, the question is valid. Absolutely, the question is valid. Totally. We should be allowed to ask questions. Of course, at the moment, we're not allowed to ask questions, or certain questions we're not allowed to ask about medical matters and about other matters in the UK, where we have freedom of speech difficulties at the moment. Anyway, let's stick to the point. So yeah, it's legitimate to ask. And of course, now, hundreds of people have asked me this question. Oh, there's more cancers. Were these people vaccinated against COVID-19? Of course, we don't know. If we knew that, we would have a pretty good answer. But we simply don't know. But governments could release data, so we could find out. And I suspect this is going to be happening in the States. And I would appeal for it to happen in the UK, because data can be released on individuals without compromising confidentiality. The MP David Davis told me that the government have ways to do this now. This can be done. So the confidentiality argument is not an argument, it's an excuse. And that's not acceptable. If it is, as one doctor commented here, that cases are up 80% from 2018, 2019, pre-pandemic levels to 2023, 2024, if cancers are up 80%, if that's true, we have to firstly confirm that it's true with all the data. It's not just one surgery, but this is what this is why we're doing this. We're seeing this time and time again. Then governments must make available everything to allow us to work out what the heck is happening here. We need to find out what the cause is. Then when we find out what the cause is, we can eliminate that cause. Now, if we eliminate the cause, we're stopping new cases. What that will do to cases already in the pipeline, we don't really know. But if we eliminate the cause, it will stop people entering the pipeline in the first place, which of course is what we want. Another comment. My friend's 35-year-old husband was just diagnosed with blood cancer. And I've done that one. Next one. My daughter is stage 4. Yeah, I've done that one. My daughter is stage 4 breast cancer, 26 years old. Ma'am, it's terrible to have a child diagnosed with a serious illness. And if you're an older parent like me, it doesn't matter how old your kids are; they're still your children. My daughter has stage 4 breast cancer, 26-year-old. She had it her whole pregnancy and they didn't find it. It had moved to her liver, so that had metastasized. She's been on chemo for 10 months. They said it was sleeping. In other words, I assume that means that the cancer went into recession. Then they did a scan that we were requesting for over 6 months, and they said she now has 15 spots on her brain. Now, breast cancer can metastasize to the brain. She's getting treatment at the moment, and we have her on every natural treatment. Of course, we wish her well as a community. So if you're the mum that wrote that comment, it's about 2,000 people watching live now. If you're the mum that wrote that comment, there's 2,000 people wish you well and your daughter well. Another comment, my 38-year-old sister was just diagnosed with aggressive ovarian cancer. Fully vaccinated, but otherwise lives very healthily. Ovarian cancer can occur in young women, but that is pretty young. Pancreatic took my dad out last year, lasted 3 months after diagnosis. So I'm afraid pancreatic cancer does have a very rapid progression at the best of times. And if we are seeing, for want of a better term, a turbo cancer, someone in Greeks donated €20. That's very kind of you. Thank you very much. The donations that do come in, we're going to use those for various projects around the world, so they will go to good purposes. And I only send money to organisations I know of personally, and if you've seen the videos, you'll know about that. People I interact with on visits and things. Right. Smoking may cause and contribute to illness, but smoking isn't mandated nor coerced upon anyone. Fair point. Another comment. My daughter, 30, lost 3 friends between the ages of 27 and 31 to cancer. So this is one daughter, 3 friends between the ages of 27 and 31 to cancer. This is not what we would expect. Not what we would expect at all. all these comments that are coming through, I will look through them. Thank you for putting them in. One young lady had stage 4 ovarian cancer and no previous warning sign. She left behind a toddler and a husband. Another comment. My friend passed from pancreatic cancer last week. Never drank or smoked. She was diagnosed after Christmas, just turned 50. Younger than we would expect for pancreatic cancer, for sure. My younger brother at 18 was diagnosed with, so depressing, but this is qualitative research, so I'm reading this to stimulate debate. People need, debate, awareness, and to stimulate research and to encourage people to start getting into the quantitative data to make that freely available. My younger brother at 18 was diagnosed with stage 4 colon cancer. Thankfully, he caught it in time and was healthy enough to survive the extremely aggressive treatment. To this day, we are thankful to have him with us and empathise with anyone who has to go through the trauma of such anomalies. Yeah. Another comment. My daughter, aged 36, with two small children, died. My daughter, aged 36, with two small children, died of neuroendocrine cancer. She was only sick for about 3 weeks, and it took that long for a diagnosis. Another comment. My 43-year-old son-in-law was diagnosed with stage 4 pancreatic cancer in September 2023. He died in March 2024. Sadly, that is the typical prognosis. 6 months. 43 is young for pancreatic cancer. It's not just young people having this problem. One of my friends had colon cancer over 10 years ago, was treated and completely healthy. So the cancer had gone into remission. 3 jabs and he has stage 4 colon cancer. Now, this is what Gus Dalgleish, the oncologist, Angus Dalgleish, is seeing. He's seeing reactivation of cancers that were in remission. And Patrick Sung Song yesterday said immunity is everything in cancer. So if the immune system is destabilized, it makes sense that cancers can recur. My cousin had early stage 4 breast cancer. She was treated and cancer-free for 8 years. It came back this past August, and within 6 weeks she passed away. This is all one person writing these the one about the cousin and the friend. And also my wife had endometrial cancer, and after the hysterectomy, the pathologist said it was stage 1A. So sometimes, depending on the cancer, they put letters on this as well. No further treatment needed. At the 6-month checkup, they found a tumour. They found an extra tumour in the area. Before 3 jabs, she was completely healthy. Of course, this is just an anecdote. Just 3 people in my life. I'm sure most of you have similar stories. The point is there's a lot of anecdotes. This is what need put together and need researched. Another comment. My neighbour came by the other day, said her 10-year-old grandson has brain cancer. These are just individual experiences, but put together, they can be used as evidence. And they can certainly point out where research needs to be done. My mum got all her COVID shots up until the end. She died January 14th of mesothelioma, despite never working with asbestos. So mesothelioma is a cancer of the pleural membranes that surround the lungs. And they get bigger and bigger and squash the lungs. It's not nice. It's not nice at all. It's a nasty condition. And all the cases I've seen have been caused by asbestos. But here we see my mum got all her COVID shots up until the end. She died January the 14th of mesothelioma despite never working with asbestos. Now, of course, she could have come into a stray fibre of asbestos when she was a child. Who's to say? The last month she turned yellow and started losing her mind. Another comment. My friend's mother and her sister, who both had cancer like 12 to 15 years ago, took the vaccine plus boosters in New Zealand, and 4 to 6 months later both got hit with cancer, and I just couldn't ignore the timing. So are we seeing a reactivation there? That is the question that research needs to be working on and answering. This is exactly what happened to my dad, March 2022, and passed away 2 years ago today, March 2023. Same as you say, looked orange and blocked bile duct. Took 3 jabs prior to diagnosis. And the last comment I've got to read out here, very perceptive one actually. Is there a way to investigate what is happening with health in Russia? Because if we had the health situation in Russia and here, we could tell the difference. Thank you, Ivan. That's very kind of you. As I say, these donations will go somewhere. So we'll go to useful ends. Right, so is there any way to investigate what is happening with health in Russia? Good point. How is excess mortality? Do they have these new cancers and rubbery clots? In Russia, they only use Sputnik vaccine and didn't push people to get it. Most younger Russians are unvaccinated. So we'd have an interesting comparison there. Now, in the Cold War, which I'm well able to remember, I remember seeing the fences and the guard towers in Eastern Europe in the 80s. Hard to imagine now. But there was always like joint projects between Russia and the United States. And I mean, one of the classic ones, of course, Nixon sent ping pong players, table tennis players to China, didn't he? Ping pong diplomacy. That was in the Forrest Gump film. So like I remember one thing. There was a whale that was stranded in the Arctic somewhere, and I think they sent a Russian nuclear submarine and an American nuclear submarine, and they rescued this whale, which is wonderful. But the point is, doing good medical research like this would be not only good to get the information, but it's a good way to let us know that ordinary Russians are just nice people like we are. And they can realise that we're just nice people like they are. It's a way to bring peoples together. Why don't we use that as an excuse? Joint epidemiology. Just a side thought there. So, good question. I don't know the answer to it. I don't know what's happening in China, or Russia rather. Then the comment goes on. China would also be an interesting study, but probably harder to get information. Well, yeah, I agree. Doesn't stop us trying though. They only use their own vaccine in China. Russia and China definitely didn't want their people to get these mRNA jabs or the AZ jabs. So what are the outcomes? Eve, I'm so sorry about your husband dying of bladder cancer. Yeah, it brings home the reality of it, doesn't it? So they're the comments on that. They're the comments on the commentary I did on the interview, or basically just the first 15-20 minutes of the interview between Patrick Sunsong and Tucker Carlson. Yeah, a lot of you are talking about your own experiences. Well, this is live. It's not actually live. There's about there's about a 10-second delay, I think. So I don't know if YouTube would suddenly cut me off if I said something grossly inappropriate or more inappropriate. Just something to try. Amazing, all these communication modalities that are now available to us. I'm just thinking of other. Yeah. I'll do it. I've just been doing some very, very basic look at what's called the Nuremberg principles, because a lot of people in the past have done things that aren't necessarily the right thing to do, and we have a structure now. Take, for example, in healthcare, where everything is so protocol driven. Guidelines are just followed. And most of the times these guidelines are right. They're good, but not always, I don't think. So just because something's done doesn't mean that it's right. And what happens in healthcare is when you start working, you enter as a human being. And within a few years, you become a healthcare professional. So when I was 18, I became a first-year student psychiatric nurse. I used to be a psychiatric nurse. I did that for 3 years. I got a registration in that. And at first, you think that some of the things you're seeing in the psychiatric hospital, and in those days there were popular institutions. And in fact, a guy called Goffman wrote a book about institutions, total institutions. And what happens in an institution is things that first look really, really weird. And of course, this is a psychiatric hospital, so you'd expect some weird stuff. But let's ignore the patients. Let's just talk about the staff. Things that seemed a bit strange, a bit really, really weird. By the time you've been there I was there for 3 years, seemed perfectly normal. It just seemed normal. You become norm reference to that. It seems like the normal thing to do. And that still happens. You work in a particular environment. I mean, in the psychiatric hospital, you got used to alternative behaviour, shall we say. And then when you work on other departments, you kind of get used to the type of suffering that's there. Now, if you ever lose your empathy for your patients, it's time to walk away. But you do kind of get used to seeing people in pain. It's never acceptable. We always fight against it. But you do become kind of norm referenced. And if there's a particular set of guidelines, so when a patient comes in with a chest pain, you do A, B, C, D. There's a standard thing that you follow. You'll do the 12 leads. You'll send off the troponins. You'll monitor them if you're concerned about arrhythmias. There's certain things that you'll always do. You'll treat the pain. You'll consider them for thrombolysis or cath lab. There's certain things you always do. And in a sense, you stop questioning. So I was just reading these Nuremberg principles here. This is kind of what got me on to thinking about this. And this is about war crimes. So we're not talking about healthcare now. We're talking about war crimes. But the principle of individual accountability, I think, is relevant wherever you work. If you're, doesn't matter what job you do. We're still personally accountable, I think. And the main thing here is Principle 1, Nuremberg Principles. This is after the Second World War, Nuremberg trials, of course. Any person who commits an act which constitutes a crime under international law is responsible, therefore, and liable to punishment. So it's any person. So to me, that this individualizes it. The fact that international law does not impose, the internal law does not impose a penalty for an act which constitutes crime under international law does not relieve the person who committed the act of responsibility under international law. So the fact that locally, internal law says, oh, that's okay, mate, or doesn't impose a penalty, doesn't change responsibility in international law, or indeed absolute morality, if you believe in that, which I do. But maybe the powerfulest one for the fact that a person acted pursuant to order of his government or a superior does not relieve him from responsibility under international law. So in other words, I'm just doing what I was told is not an excuse. Provided a moral choice was in fact possible to him. Well, everyone's capable of moral choice, I think. Very hard to imagine a circumstance where you're not capable of moral choice. So just saying that I'm doing what I was told, not an excuse. We have to think for ourselves. Not sure how that fitted in, but it's just what I was thinking about this afternoon. The idea of individual responsibility. Acting is we have to make sure we don't become normalized to aberrant norms. Because saying we just do what we're told, not an excuse. In international law anyway, according in war crimes, but I would say that's true of everything. Right. Somewhat unstructured, but there you go. Right, I think we'll leave that there. Thank you all those that have tuned in. The main theme of this was the feedback, and looking through the comments, we've got hundreds of individual cases, perhaps thousands, that I think do start to constitute evidence that should be followed up, and for governments not to do so, I will consider inappropriate that they don't follow up. Any comments I can do briefly? They go past a bit quickly. Oh, is that Martin Luther in the background? Yes, it is. Okay, yeah, right, okay. So in the background, I've got a picture of Martin Luther on the cupboard door. Why did I put Martin Luther up? Well, I think because he was his own man. He looked around at what was happening and didn't like some things he saw was happening. So he wrote up, was it 92 Theses or something to verbalise his opposition. And whether you agree with Martin Luther or not, I personally do, but if you agree with Martin Luther or not, it doesn't matter. He was prepared to die for his belief. He was threatened with death and he did not retract. So that's why I put Martin Luther up. Good revolutionary. And the other one, of course, in the back is George Orwell, 1984, who foresaw much of what appears to be happening at the moment, sadly. And I've got some other pictures I might put up at some stage as well. Yeah, Caroline says, I like Luther as well. He had guts. He certainly did have guts. I think he married a nun. Quite an interesting story. Who ceased to be a nun, of course. Anyway, yeah, I think we'll leave it. If you like this live format, we can think about doing it again, even if it is a bit waffly. But oh yeah, I see Winston there. I'll tell you about Winston as well. So this is Winston. He's a black dog. So there you go. And of course, Winston is named after Winston Churchill, the wartime Prime Minister of my country. And Winston Churchill was visited by the black dog. And of course, the black dog is the black dog of depression. It descended on him and he became depressed. And when you're depressed, things become difficult. You start to believe there's no hope. You start to believe there's no future. You might even start to believe that you deserve it. But the point is, there is hope. There is hope. So whatever situation you're in now, or whatever situation we're in collectively, there is hope. But very often we need help from our friends. But the reason I put this up is the Black Dog Ride is a ride out for motorbikes in Australia. I'm a motorcyclist, so I was able to visit Australia a few years ago and took part in this Black Dog Ride. And it's to raise awareness and funds for depression in Australia and wider. So that's where it comes from. But the reason I put him up is because, in a sense, your mental attitude is just so important. And of course, we talk a lot about physical illness, but of course, we must always remember that the psychiatric component, as represented by the black dog, is always there, because man and women are bio, psycho, social, physical beings. We are everything, and you can't leave a bit out. So that's the black dog. Anyway, while you're there, I'll show you a couple of other background things. This one's the vitamin D man. Now, I can't remember who sent me this now, but someone kindly did it in the States and sent it to me. So it's the vitamin D doctor, I guess. I don't think it's based on anyone in particular, but they do have a black dog with a W on it. What a beautiful piece of work, though. So kind of someone to send me that. And it got here without getting broken. So there you go. That's the vitamin D man. Yeah, that's him. Yep. So like that, put that in the background. There we go. Now, if you want my books, so all these posters, I've got loads of these posters. If you want the posters, and I've written a couple of books. I'm getting too many books. I'm going to have to sort them out. I'm getting piles of them. So personally, I've written this one about physiology, and this one on pathophysiology, which is a bit thicker, about all the diseases. Now, I think that I've still got about 100 of these left in hard copy. We've sold thousands in hard copy. But basically, I've made these both available free in PDFs. So you can, I'll put the link on. You can click on the link and you can download the full PDFs in full resolution of those free, because I've put them in the public domain. Took me ages to write these. Like, that's pneumonia. What else have we got? Endocrine disorders. Now, I tend to think in sort of diagrams and schematics as well, which you can colour in. Anyway, they're available free download. Do what you want with them, as long as you don't resell them. That is fine. I'll put the link. You can download those. do that for homework. Yeah, I need to sort these books out. There we go. So many interesting books, never get time to read them all. Right, stop prattling on. Thank you for watching. If you like the live format, we can think about doing it again. But for now, thank you so much for tuning in. I do feel like, it's not quite the same as being in the same room, but it's pretty close. It's pretty close. It's kind of weird. We do feel like there's a connection. Right, thank you. And in England, it is, what time is it? 11:25. My bedtime. So have a good evening or day wherever you are. Thank you for watching.